HIV is a virus that attacks the immune system, specifically T cells. It was first discovered in the United States in the 1970s. HIV can be transmitted through bodily fluids such as blood, semen, preseminal fluid, vaginal fluids, anal fluids, and breast milk. It cannot be transmitted through saliva or urine. HIV is at its highest risk of transmission during unprotected anal sex, followed closely by unprotected vaginal sex. HIV can also be transmitted from sharing syringes or needles used to prepare injection drugs. It is rare, but it can also be spread from mother to child during breastfeeding. There are 3 stages of HIV. The first stage is the acute infection stage. These symptoms include flu-like symptoms for 2 to 4 weeks after the infection. Stage 2 is the clinical latency stage. This stage has no symptoms as the virus is at very low levels in the body. This stage can last over a decade without medication or several decades with medication taken to suppress the virus. Stage 3 is AIDS. These symptoms include chills, fever, sweat, and weight loss. This stage also has increased infectious diseases due to the lack of T cells in the body. Anyone can be affected by HIV, but it is the most common for African American, gay, and bisexual men. Risk factors for HIV include having unprotected anal sex, especially in the gay community, having unprotected vaginal sex, injecting drugs, or sharing syringes. HIV is diagnosed through a rapid test. This test can be done in 30 minutes, and it uses blood or oral fluids to look for antibodies of the virus. If this test is positive, a follow-up diagnostic test is performed. This test includes an antibody differentiation test, a nucleic acid test, or a Western blot test to test for antibodies for the virus. There is no treatment for HIV, but medication can help to suppress the virus. Antiretroviral therapy, or ART, can suppress the virus and help the immune system. The only way to prevent HIV is abstinence. However, if abstinence is not performed, using condoms while having sex can also decrease the risk of transmitting HIV. Medications such as pre-exposure prophylaxis, or PrEP, can prevent the virus if one is at a high risk for it. There is no vaccination for HIV either. In 2014, 44,073 people were diagnosed with HIV. About 1.2 million people in the United States are living with HIV, and 1 in 8 people do not know that they are affected with HIV. 44% of people with HIV are African American, while 27% are white and 23% are Latino. 67% of new diagnoses are from male-to-male contact, 24% are heterosexual contact, 6% from injection drug use, and 3% from both injections and male-to-male sexual contact.